So I'll start on my right-hand side with Dr. Mwambene, and then we'll go through this way. Just a highlight of your key observations.
Okay. Generally, I can say with COVID-19, when it comes now to issue of mental well-being of individuals, there is a lot of fear, a lot of worries when it comes now to COVID-19. So this has created a lot of anxieties within our communities. There is a lot of fear when it comes to fear of getting the infection. And then because of that, people, they have a lot of anxiety. And when it comes now to anxiety, because there's a stress, then develop anxiety. This lead now to weakening the immune system. And by doing that, now it made this somebody more prone or more vulnerable now to get the infection. And also for those who have already got infection, there's a fear of dying, fear of death, fear of leaving the loved one, especially the children, the spouse, the parents. You know, so this fear also create anxiety. And this anxiety, as I said earlier, it's keep on weakening the immune system. And by doing so, then it complicates even the outcome of the disease. And some, they can have overlap of the symptoms. When now they develop a full-blown anxiety. Anxiety is a mental disorder, but it has the symptoms that mimic the physical disorders. And overlap of these symptoms really complicate the picture of the COVID now to the patient who is now suffering from the COVID. Like the symptoms like anxiety can have symptoms like headache, which COVID also has headache. Anxiety can have symptoms of chest pain, chest tightness, shortness of breath, which also COVID has all those symptoms. Anxiety can have symptoms of general body weakness, which also anxiety have those symptoms. So you find that the more anxious they are, they go into developing now a full-blown of anxiety. Now they have also the really physical condition, which is COVID. Now the symptoms overlap, and this complicate the picture of the COVID-19 and keep on weakening the immune system and lead to poor progress of the disease.
Yeah. Thank you. And the relationship between anxiety, fear, and COVID is fascinating. So thank you for sharing that.